Hey guys, welcome back. Listen, I was loving all of that sunshine and warm weather that I was feeling outside on the porch, but y'all listen, those cicadas were out of control. So I had to come back inside for the discussion that we're about to delve into right now. And this is the part of the day where the conversation gets a little bit uncomfortable. But nevertheless, we need to talk about it. And so we're going to talk about it. And as you guys know, this entire week, the Chronic Disease Coalition is focusing on areas of discrimination in the chronic illness communities, in the healthcare communities at large. And I want to talk a little bit about that, specifically in reference to Black people and people of color. So, no holds barred, we're just going to get into it. Black Lives Matter. We have been hearing it. We have been seeing it. We have been reading about it, especially in the last few weeks and months here all over the country, right? And for many of us, it is a rallying call for equity, for justice, for visibility, and fair treatment. And yet others view it as a means of causing more division, right? And that's simply not true. I can tell you that as a Black woman, specifically battling endometriosis over the last 12 years, I have faced a lot, quite a bit of discrimination, some of it overt, some of it in the form of microaggressions. And unfortunately, the world of endometriosis is no different. And I wanted to talk about that today because I find that, particularly in the endometriosis community, whenever we try to share stories or incidents or highlight the fact of particular racial disparities amongst Black people, we're often met with strong resistance and cries of, why does race always have to be brought into everything? Or why are you trying to divide the community? Or we all suffer from this disease? Or I don't see color, or endometriosis doesn't see color. And that is true. Endometriosis, this disease absolutely does not see color. But unfortunately, a lot of the doctors and medical professionals that are tasked with helping us to treat and manage this disease, they are. They do see color. They are racially biased. And let me just give some historical context so, people won't think that I'm speaking just from a place of emotion or upset. Going all the way back to the 1800s, J. Marion Sims, who, if you don't know, is often considered to be the father of modern gynecology. He is known to have performed horrific, unanesthetized experience on Black enslaved women because he was of the mindset, and I quote, he understood enslaved women not to have the same pain threshold as white women. That was in the 1800s. Fast forward to 1953, endometriosis was historically and expressly characterized as a disease of affluent, high achieving white women with private health insurance who delayed marriage and childbirth. Okay, there were studies published in the 50s that stated clearly and blatantly that endometriosis was simply not common in Black women, and that most of the women were well dressed and had trim figures. Okay, moving into the 2000s. In 2012, an analysis of 20 years of public research in the United States found that African American patients reporting pain were 22% less likely than white patients to get pain medication from their doctors. Another study found that African American patients reported less effective pain management treatment plans, often because most doctors falsely believed that patients of color were likely to abuse prescription painkillers. And yet another study done nationwide amongst doctors, 72% of whom were white, often underestimate the pain levels in minority patients. And so the statistical facts support the notion that Black patients, Black people, are treated differently. when it comes to healthcare. And so, again, the endometriosis community is no different. And so, when we talk about Black Lives Matter, what are we saying? What do we mean? And I think that one of the most common misconceptions when we talk about amplifying Black voices or voices of color is that when we say Black Lives Matter, we're implying that Black Lives Matter more than other lives, or that Black lives are better or more important than other lives or other people's struggles. And that is not at all what we mean. That is not at all what we are saying. What we mean is that, or what I mean when I say that, is that we are speaking to all the systematic oppression and racism and bias that in the midst of all of that, that has been embedded throughout this country. It's a difficult truth. It's a hard truth, but it's the truth. That in all of that systematic oppression, we are fighting to be seen, to be heard, to receive the same care and concern and compassion as our white counterparts. We are fighting to be included, is what we are saying, in those systems, in those structures, in those spaces in the world that for so long has told us we don't belong. So what we're saying is not that Black Lives Matter more, but Black Lives Matter too. We're just wanting to matter in addition to all of the other lives, in addition to all of the other voices. We just simply want to be heard as well. Not more than, not better than, but in addition to, right? And so when we talk about chronic illness communities or endometriosis communities, we often hear language talking about we're a family, we are a community. Well, if a member of my family is hurting, then I am hurting. And my family cannot advance or do well or progress if a brother or a sister or a cousin is being left behind. And so, in this global family of endometriosis patients, of chronic illness patients, if the Black patients are not receiving the same care, if we are being left behind, then all the community can't matter, because are not Black people part of the community? Are we not a piece of that? And so we need allies. We need your voices. We need you to help us to be heard. And when you hear those stories, rather than immediately jump up to reject the notion or resist the notion, how about take a breath and pause and reflect for a moment? Reflect. Can you remember a time that somebody you knew, you know, experienced those things? Um, have you seen it? Have you heard it? Have you laughed at maybe an insensitive joke? Just do a little bit of reflection. And if you want to know more, take it upon yourself to get educated, research the statistics, the information. It's all out there. Don't resist, don't reject, but rather try to receive what's being said, right? And it may make you uncomfortable. It should make you uncomfortable, but without challenge, there is no change. And like one of my life coaches once told me, that you cannot conquer what you don't confront. So it's okay that you feel uncomfortable, right? And let me say this too: acknowledgement is the first step to allyship, right? So don't think because you acknowledge these disparities, but that somehow makes you complicit. That's not that what we're saying. We're not saying it's your fault or you did it. What we are saying is that these things exist, these things happen, and unless you even acknowledge it, we can't begin to have the conversation which leads to the actions that will lead to the eventual change, right? And so it may be a little bit uncomfortable for some people to hear, but it's the hard unadulterated truth, right? And I speak a lot in my advocacy about educating, enlightening, and empowering. And I wholeheartedly believe that one follows the other. So when it comes to issues of racial disparity or bias or discrimination, reflect, right? Receive what is being said, then educate yourself, because once you're educated and that light bulb goes off and you receive new revelations that you didn't before, then you become enlightened, right? And once you are enlightened, you then can become empowered to start making those small steps of action toward change. Okay. And just start there. And how do you start with allyship? What do you do? How do you start? I'll share with you the premise that I share with a lot of my endometriosis allies. So people who don't have endometriosis, but they're affected, they want to know what they can do to help, how they can support, how they can amplify and ally. And I tell them one simple step: start here. I hear you and I believe you. That is a most perfect place to start. And that can translate over into conversations about race, into stories about racial discrimination and racial bias. Don't jump to resist, but pause, reflect, receive, and respond with I hear you and I believe you.